Let's talk about the treatment options.
Okay.
And you also said if picked early, of course, we can prevent blindness.
Yeah.
And then, of course, if it's late, I mean, it's irreversible, sadly. But now let's just talk about the treatment options in general, and then what determines what kind of treatment someone gets from the other.
Okay. So basically, the main thing in glaucoma is that we want to bring the pressure levels back to normal.
Yeah.
Because the high pressure is the one that is destroying the structures in the eye. So once we bring the pressures back to normal and maintain that level, then there'll be no further damage to the nerve. That's why I tell patients, I'm not going to improve your eyesight, I'm going to maintain what you have.
Yeah.
So the first thing we usually do is put them on eye drops. So there are many different kinds of eye drops specifically for glaucoma, for lowering the eye pressures. If that doesn't work, there's a new advanced method we call it's called laser. So what the laser does is that it goes and unclogs that drainage system. It's a very good, actually it's what is being used worldwide right now as even the first option, because people don't want to put eye drops for life. Eye drops are for life. So what I tell them, fine, we can do the laser to unclog the drainage system, and that way you'll be fine, you know. If that doesn't work, then, and in very, very severe cases, that's when now we opt for surgery, where we make a small opening on the surface of the eye, like a small window, to let the pressure out. It's like plumbing. We just open a little window, and the fluid drains out very slowly, but you don't notice it as a patient because we somehow cover it, and it won't be, you won't be tearing for the rest of your life. The fluid is controlled and it's absorbed into the eye. So that is usually the final, the last step. Laser is actually very good, and I encourage my patients to get it so that they don't have to use so many different eye drops. But it's expensive. It's expensive, and it's not available in most hospitals. Like in, we don't have it in Kenyatta, but we have it in Aga Khan. So the patients who can afford Aga Khan have the laser done there, they're happy, you know, but most of the patients in Kenyatta are not able to. So it's affordability and accessibility of the laser. But the eye drops, at least they are available, and but once you start using them, you have to start using them for life.
For life, And on the eye drops, we've seen people who, let's say, have like an allergy or just redness of the eye, and they just want to clear it, and of course go to over the counter and get eye drops. Are they the same eye drops that a glaucoma patient uses, or
no,
theirs is different?
The glaucoma eye drops are specifically for glaucoma, for lowering the eye pressures. So they have to be prescribed by an eye specialist, somebody who knows that this patient has high pressures and needs these eye drops to reduce the pressures.
Okay. Yeah. All right. And for life, I'm trying to think. I think that might be expensive as compared to the laser in the long run. That is, but of course, we're here right now. Someone might be like, oh, well, let me opt for eye drops. Okay. All right. Now, what are the chances that the laser could not work?
Okay.
Yeah, and for the surgery, are there complications related to the same?
Yeah. So the laser usually works very well in 90% of the patients. And I tell my patients there's nothing in life that is 100%.
100%. True. Never say never.
And taxes.
Okay.
But the laser is never 100%. So it's about 90% effective. And sometimes it might not get you down to the very low pressure, so we can augment it with, maybe you can still use one of the drops, because the drops are expensive. You know, on average, a good quality glaucoma eye drop costs about 1,800 or 1,500. And sometimes we prescribe 2 or 3 drops if the pressure is so high. You know, so you find a patient is spending about 5,000 a month. Just on glaucoma, and maybe they have high blood pressure. They still have high blood pressure medications. Maybe they're also diabetic, or they have arthritis. So they have all these other problems. And yet, for me, I'm like, I want you to see, so use these drops. So the laser can help to either eliminate all those drops or reduce the burden of maybe we can tone it down to just one medication, which is more affordable to the patient. But When it works very well. But if it doesn't, it doesn't. And I advise the patients on that. When it comes to surgery, patients are usually a little bit, you know, scared of surgery because when you tell them there's a window and all that, they're like,
no,
I don't want anyone
sounds
touching
painful.
my eye. But sometimes we have to, it has to come to that because the laser doesn't work, the pressures remain high, the drops are not working. So the surgery can have its own complications where that little window either drains too much or drains too little. But there are interventions we have to, we do after the surgery to make sure that we deal with the complications.
Okay.
So there's always something we can do. The main thing is that after you've had the surgery, you have to come for regular follow-up.
Follow-ups, yeah. All right, and how long does it take for someone to completely, let's say, heal and just see normally?
So after the surgery,
yes.
So even by the next day, you can be able to see, because we usually put a bandage, remove the bandage the next day, and start you on eye drops. But for the eye to like go back to its normal state, even for any part of the body, it's 6 weeks. But by the next day, you're able to see. Then we put you on some eye drops to just help the eye to heal. And after about 6 weeks, you stop the drops, and you're fine.
Okay.